Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins. Joining us this afternoon, Pepin County Health Officer Heidi Stewart, as we get an update on COVID-19. We haven't talked in quite a while, Heidi, because, well, things were going down and vaccinations were going and that sort of thing. But suddenly all of that's it's changing with this Delta variant. So, but first, let's talk about some very good news. Pepin County is starting to turn purple on the vaccination page, which means our vaccinations are going up.
Yeah, we did share something on our Facebook page today. The state of Wisconsin is over 51% of individuals who have received at least one dose. Pepin County is at around 44%. The state continues to put out more information. And if you look on the website, excuse me, I have a tickle. If you look on the website for data, the DHS website, it does have a map where it breaks down vaccination rates by census tract, by zip code, by school district. And that's information that we can use as we do planning within those communities. You know, if your vaccination rates are high, your transmission rates are low, the concern isn't as high. If your vaccination rates within your community are low and you have high community transmission, that might be an area where we need to ramp up some of those prevention measures, as there would be more concern.
And so with this, I know with this new Delta variant, we've had some new cases here in Pepin County, and you've been able to you do the testing on what it is, and we do have Delta here.
Yeah, so let me show a few different things. I think I'm sharing my screen, and for those of you that aren't able to watch this, I'll talk through it a little bit. The CDC does have a data tracker, and Brian's correct. We have had some cases. They started around mid-July. We've had a total of 16 positive confirmed cases of COVID. 14 of those are still active. It's been in different geographical areas. I know last week we shared some information about an outbreak in one facility. Well, those 16 cases are not all in that facility, and now we just have some sporadic non-related cases throughout the county. Businesses, group homes, somebody identified being at their only potential exposure would have been at a local bar where they were around a bunch of people. So it's kind of all over the board as far as where the cases are coming from. So it's not so easy for us just to put our finger on it and say, okay, let's isolate and quarantine this group and then we're going to be okay, because there's a lot of the cases that are not related. We have had one of the individuals in that 16 was fully vaccinated and did then test positive months after being vaccinated. So we have sent that to the state lab for sequencing, which tells us whether or not it's the Delta variant. We've also had an individual who had COVID months ago and now has tested positive again for COVID after a period of several months, more than the 90 days that we would typically look at. So this was after re-exposure. So we did send that one into the state as well for the sequencing. So you can see here with those 16 cases on the map you see here, Pepin County is considered a high transmission right now. Because of our low population, we do transition through those transmission categories very quickly. So if we don't have any cases, we're at low. For us to go from moderate to substantial and then high occurs rather quickly because of our low population. So something to think about there, a couple things to think about there. To get back to the second portion of that, I'm going to share another screen, and this would be from the Wisconsin State Lab of Hygiene sequencing. So those, I mentioned that we've requested that those go to state lab to be sequenced. They do it when requested, and they're specifically sequencing right now for the Delta variant. And well, they sequence all of the ones that come in, but what they're seeing is a significant increase in the Delta variant. So if you look at the sequencing numbers over time, April almost zero, May very, very few Delta variants popping up. So, and this is as it relates to Wisconsin. I don't have anything specific for Pepin County. So as it relates to Wisconsin, into June, there's a little bit of a spike. And then from June to date now, it quickly rises from around 10% in June to about 85 to 90% of the sequencing that done is coming back Delta variant. So I think it's pretty fair to say that it's in the nation, it's in the state of Wisconsin. And the way we've seen cases spread here pretty quickly, it would be safe to assume that that Delta variant is here as well in Pepin County.
Talking with Pepin County Health Officer Heidi Stewart this afternoon. Heidi, the CDC's now all of a sudden changed their guidance on non-vax or on vaccinated people having to wear masks indoors. Is that something that is going to then potentially change how schools are going to operate or anything like that? Have you heard anything from the state DHS about where do we go from here with that?
So from what I'm understanding, CDC has changed their guidance, which was effective yesterday, and it's guidance. So it's not an order, it's not a mandate. So the CDC is not doing that. They're recommending that everyone, regardless of your vaccination status, wear masks in indoor public places. And really, this isn't a response to that Delta variant. And some recent scientific information has shown that individuals who have the Delta variant may be able to spread that to other people. So in addition to this consideration put out by the CDC, we need to think about all those things that we've been doing all along. The hand hygiene. So if you don't have access to hand soap and water, hand sanitizer, physically distancing yourself between yourself and other people, covering your cough, covering your sneeze, cleaning, disinfecting. I think what I've at least seen over the summer is that as the cases went away and we were good, we completely went away from a lot of those prevention measures. And it's time to start looking at those again and starting to re-implement those. Now, what that means for our schools, I don't know, but it can't just be the schools doing all of these things. It needs to be everyone in the community looking at the ways that they can prevent the spread. So continue those outdoor activities. And I wish all the kids that are fishing today good luck. That's a fairly safe outdoor activity. Featured on WEAU this morning. So yay, Duran Youth Fishing Contest. And finally, you know, I didn't mention it yet, but we do still have vaccines here and we can schedule appointments. So if you haven't received your vaccine yet and you've thought about it and it's something that you've decided you want to do, we do have it available here and we are trying to be as accommodating as possible to anyone who does want to get vaccinated.
And they can just call the health department for that. And for testing, really still, if someone wants to get a test, they can do that up at Advent Health, right? I think they're the fastest in turnaround in the state. They're
quick. Yep, they're quick. I did notice when I was looking at our statistics that, you know, as case numbers go up, so do testing numbers. So, you know, there might be a bit of a wait. They might ask you to come at a specific time. Certainly, you definitely have to call ahead. You can't just show up for that.
All right. Well, Heidi, again, we appreciate you as always for joining us. That is Pepin County Health Officer Heidi Stewart. You're listening to Real Country 1430 AM and 107.3 FM WRDN.